Hi there. My name is Tanya Jenke. I'm a PhD student at Edith Cowan University in the School of Health and Medical Sciences. Marcus?
And hello, my name is Marcus Cattani. I'm a researcher in the School of Medical and Health Sciences and also associated with the Mars Centre. So we're going to present to you some information in a brief format to do with some surveys that we've been doing as part of Tanya's PhD. And hopefully this will give you some information about benchmarking your own organization and then also contributing to the improvement in performance that we're going to justify now.
So our research was based on a book published in 2014 by Professor Michael Quinlan, who looked at about 20 different fatalities in 5 different countries: Canada, the US, Australia, the UK, and New Zealand. And through his analysis of there, he identified 10 pathways that were the result of those fatalities. Most of the pathways or incidents had at least 5 of the pathways, and many had several more. And the details of each of the pathways are detailed in his book. And in summary, they really follow 10 specific pathways. First one being design and engineering, the second one being prior warning or causes for alarm ignored, third one being failures in risk assessment, fourth is failures in management systems and hazard system plans. 5 is associated with failures with auditing. 6 is around economic pressures and how they compromise safety. Number 7 is failures in regulatory oversight and inspection. Number 8 is workers and others expressing concern prior to the incident occurring. Number 10 is around poor management, worker communication, and trust. And finally, number 10 was around emergency and rescue resources and procedures.
So we decided to interpret these chapters in the Quinlan book as a way of collecting information about organizations' fatality risk. This was prompted by the Mine Safety Roadshow that the West Australian government hold each year for the mining industry. And thanks to them for the ideas 5 or 6 years ago. But basically what we did is we converted the Quinlan 10 pathways into a questionnaire that individuals could answer during the Mine Safety Roadshow. The questionnaire really asked individuals to record their perception of their employer's effectiveness in each of the 10 pathways. So the questionnaire created a profile really of participants on that day. And one of the findings that we're going to talk to you in a moment is to respond to that. But we couldn't determine or individual organizations or other identifying information. But in the future, we think that might be an idea. So over 2,500 or 3,000 people took part in our surveys. The first paper that Tanya and the other collaborators wrote in 2021 or came out in 2022 in Safety Science gives a lot more detail about the questionnaire and the validation of the questionnaire. What we want to do now is tell you a little bit about the results in 2 parts.
So firstly, if we look at the results that we had from 2017, 2018, and 2019, across each of the pathways, we can see that we had an average response score of 6.7 out of 10. 10 being that employees perceived their employers to be very effective at fatality prevention, and a score of 1, employees not perceiving their employers to be very effective at fatality prevention. So with an average score of 6.74, there's certainly room for improvement across each of the 3 years. a couple pathways that I want to draw your attention to that scored quite high were risk assessment. So generally, the attendees of the Demers Roadshow found that their employers were fairly well prepared and effective at risk assessment. However, if we look at something like auditing, this one scored generally low over the course of the 3 years. There were a couple gaps in pathways 1, 7, and 8, and this was just because we didn't have time to collect those responses during those years.
Okay, so then we had a couple of years break because the roadshow wasn't being administered by the government for COVID and other reasons, but we managed to administer the questionnaire in 2023. So between 2017 and 2023, there's been a whole series of initiatives from the government and in industry to make differences to the fatality performance. The industry performance is actually detailed in that paper that I just showed later, but the fatality performance is roughly the same, which is obviously disappointing. The other thing that I suppose was disappointing is that in 2023 we didn't really detect a great deal of change. In fact, Tanya's analysis has shown that that change was insignificant between the different years. So this has created a great deal of interest in Western Australia mining industry, because we thought we probably would have seen a bit more of an improvement. Maybe we were better than the 6.74 average from the last years, but we're not. So what we're brainstorming with industry and the government and the team of researchers is how can we assist industry improvement in fatality risk. What we're going to go through now is just very briefly what we think what we should do. First of all, sort of holistically, we're going to make available the questionnaire in a slightly different format so that individual organisations can administer the questionnaire themselves. Because like I said at the beginning, the questionnaire that we've reported here was administered across everybody that attended the mines roadshows without us understanding or collecting information about where they'd come from. If organisations collect this information within their own teams, they'll have better definition about their performance in there. The other thing we've seen is quite strong variation in the perception of individuals, which indicates there's some really good work going on and then maybe some not so good work going on. So what we wanted to do is try and create a way in which we can share some of that good work. So what we've done is we've created a website, and that you can then choose, if you like, to share some of your information. And we've already got quite a lot of information from industry, government, and other ideas about how organisations can improve their score, and therefore we think improve their fatality risk. Do you want to say anything about these ones, Tanya?
Really, our intention here around the recommendations is just to provide a clear, easy method for organizations and industry to follow these recommendations so that they can improve their performance. Specifically in here, we've highlighted some key recommendations. It suggested that organizations look at where they would prioritize based on these pathways and focus in on some of the key recommendations based on those pathways.
Excellent. So we'll encourage people through various conferences and papers and promotional activities to have a look at the website and to download and use the questionnaire, and you'll see there's a couple of different formats for you to administer that questionnaire, either independent of us, but we'd also like to be involved if possible, and so we'll add some value if you choose to involve us in benchmarking your questionnaire to the work that we've done so far. So in summary, we think that the questionnaire is a very useful way for organisations to assess their trends in fatality risk prevention. We think there's some limitations in the data that we've collected across the whole state, so we're going to offer that to individual organisations, and we'd really encourage people to share their ideas, which you can do by filling out the questionnaire online or contacting us. Thank you very much.
Thank you.
Right.